today. We will be discussing the Pexip telemerge video conferencing platform that many of you have probably registered for. So I'm going to go through a few slides that just describe the basic functionality, and then we'll have time for a question and answer period. And if you have questions, you can put them in the chat down here, or you can just save them and we can answer them at the end. I'm just going to share my slideshow with you. Okay, so from your physician or host point of view, your first step is going to be to log into telemerge. So your mytelemerge.ca and log into your account. When you log into your account, you see a home screen dashboard that looks something like this, where you'll have on the left-hand side recent contacts that you've made, and then there's an option to see other people's virtual meeting rooms. And then here you'll see this button called Room Link, which is very important because that's what you're going to press when you want to get this link that you need to give to a patient in order to find you. And this link is permanent, so it doesn't change appointment to appointment. So once you've given the patient the link once, they're never going to, well, they shouldn't need it again if they save it. And then they're able to just access you at that appointment time. They don't need another link at that point. So after you have logged into Pexip, you're going to want to go in and actually enter your room. So you would join through the browser. There's a web version. There is a desktop app. Sorry, just got some background noise. Just make sure that you're on mute, please. Okay, so you can join through the browser. There's a desktop app, and there's also apps for iPhone and Android as well. So different ways to access the virtual meeting room. So once you click join through the browser, you get to this second screen that allows you to check your audio, check your microphone with this green bar on the side, and then check your video and everything. If everything looks good, then you click join now. And when you join into your room, it'll say that you are the only person in the room and you're waiting for other people. At this point, you can lock your room until you're ready for your first patient of the day. When the patient arrives and you have your room locked, this is a screen that they will see. So they can't enter if you have the room locked. When you unlock your room, this now becomes enabled and they can join through the browser. The patient will appear in your room, something like this. And at this point, you want to make sure that you have your two participants in the room. So this is the patient and yourself, and you'll make sure that you're expecting that it's who you are expecting. And then you want to make sure you lock the room. And when you lock the room, this little tiny keyhole will show up on the physician's view and on the patient's view. So if you can have your patient help you remember to lock the room, that could be helpful. So a couple other things with this view. At the end of the appointment, obviously the patient can hang up themselves. If they don't do that, you can come in here when you click on participants and you can disconnect the patient as well. The other things to highlight on this screen, which is essentially like the host screen that you would see, there's this button in the top left with this screen and this arrow, and that's how you can actually share it. It'll say start presentation, and then it will give you an option of which desktop window you want to share. So if there's something you're looking at and you want the patient to be looking at the same thing, you can do that. This is a full screen button. I wouldn't really worry about that one. This chat button is actually quite helpful if you are experiencing audio or video difficulties, because you can just type in here if you need to connect via phone or something if your audio isn't working. This cog wheel will allow you to set your microphone and your video and your headphones if they're not the default ones that are built into your laptop or computer. The lock unlock button is also shown on the host view. And here again is that little keyhole. And when you click on participants, you can disconnect patient. So just sort of going through everything at a higher level. So basically, before your patient has a video conference with you, they need the link to your virtual room. So how that's communicated to them will vary practice by practice. Some practices are emailing, some are using text, phone calls, in appointment letters. To just be mindful that, you know, the email you send it from or the text number you send it from, the patient would now have. So if that's not an avenue of communication you want to open up, just be mindful of that. So at the patient's appointment time, they would click the link that you give them, and then they would probably see that your room is locked if you're already in with the patient. The physician has logged in, and now you're in the room. And as soon as you unlock it, the patient now can enter with the join via browser option, or on their phone, it will show that they can now join. Verify that your participant list includes the patient and only the patient you're expecting, and then lock the room. And you'll want to verify, there's a couple of best practice things coming out in terms of verifying patient information if that's not somebody's face that you recognize, to make sure that you're obviously recording in the right patient record, and documenting that as well in your note. Do your thing, do your appointment, and then at the end you can disconnect the patient if they don't do that on their own, and then just keep the room locked until you're ready for the next appointment. And then I'll say it a third time, because if you have any takeaway from this, this is what hopefully you'll remember, that if you don't have that room locked, another participant could enter. And because your link is permanent, essentially anybody you've ever given that link to, if they get to your page and it says join via browser and your room's not locked, they could come in and potentially you could be seeing a patient at that same time, which would not be a happy situation for anyone. So that's the very important thing to remember with this, and hopefully it'll just be one of those habits that you kind of, you know, develop, like locking your screen when you walk away. You just, your room should really only be unlocked for a very brief window of time when you're expecting a patient to join you. So that is the presentation. Oh, there's one more slide here. This has some information about who to go to for help. So for yourselves, providers, account holders, eHealth Service Desk will be able to help you out. For patients that are having more issues with like the Telemerge app or the web experience, they would phone the Telemerge support desk. And if you feel like after this webinar, you still want to do like a one-on-one session and trade virtual rooms and practice a bit more, please reach out and we can definitely book that and set that up for you. You're also welcome to send your link to friends and colleagues and get more comfortable with it that way as well. So that is the formal piece of the program. So now we'll just open it up and see if anyone has any questions. Just have to unmute yourself as well.
So I'm a real neophyte at this. I'm Dr. Fraser, an orthopedic surgeon. And I haven't even downloaded the app or anything or whatever. So how do we do that?
So we can, it's probably the easiest to set up just a one-on-one appointment, and then we can, we can help you out in terms of like even remoting in to see what you're looking at versus going through right now. So I think I'll take down your name and I will have somebody reach out to you to set up a one-on-one. Is that okay?
Sure.
Okay, perfect. Okay. Everything, I mean, essentially what you need is in that registration email that they send you. Have you gotten that far?
No, I haven't gotten anywhere.
You haven't gotten anywhere. Oh, okay. So we need to do the account registration first. Okay. So I'll send your information so that eHealth will set up your account.
Perfect.
All right. Okay. Any other questions?
I just have a question just to confirm that if we have downloaded the app on a device, can we use that app to do this, or do we have to go through the browser?
You can definitely use the app. There's lots of people that are sort of using the iPad app as their video, and then they have their laptop to do the documenting, so they can kind of have two things happening at once. But yeah, you can definitely host people in your room using the app on the Android or iPhone or iPad.
Okay. Because I was trying to do that. The orientation video that was sent on registration, I was using that this morning, but it won't let me join through the app. I had downloaded the app, but it won't let me do that. But if I use the browser, I can join in. But the problem that I'm having with the browser is that I'm not getting the sound through that. So not sure what's happening.
All right. So I think again we'll book a like a one-on-one so that we can figure out specifically what's up with you.
Okay.
Is that okay? So yeah, I'll let somebody know to reach out and call you, give you a call tomorrow. Anyone else?
I have a question just about practicality. So, if I have a clinic and say I finish my appointment in 10 minutes and it was slotted for 30 minutes, how do you practically then get the next person early to go in with your clinic? Because if they're in the waiting room, I would just call them in, right? And keep going.
Yeah, absolutely. Yeah. So there's no virtual waiting room with this platform. Some of the other ones available, I think there are, but if you're running early, yeah, I mean, you could try calling the patient to say, is it okay if we log in early? But yeah, you can't just go grab them from the waiting room if you're running ahead. And the same thing sort of applies if you're running behind as well, that you might get a patient trying to join if you haven't finished with the person before them. So scheduling and things like that, I think may need to be sort of fine-tuned in terms of it's a bit harder when you're not in person to be able to move people along at the pace you're going at, right? Versus the exact scheduling of it. So
are most people leaving like a lag time between?
Yeah, instead of doing like the back-to-back appointments, I don't know if most people are doing it, but the recommendation is to leave a bit more of a buffer, like 5 minutes at least between appointments, so that if you're running a little bit late or a little bit mostly if you're running a little bit late, that at least gives you a bit more time to finish up.
Okay, thank you.
Yeah.
Hi, it's Jim Fraser again. Is this recorded? Like, do you keep it, or do you just, or is it just when it's over, then you make your note like you always do, or what happens?
Exactly. So there's nothing recorded during the appointment, and it essentially is just, instead of being in front of you, the patient's on a screen. So any documentation, all of those kind of things would be the exact same, with the addition of documenting that this was done via video and that you verified that the patient was at home and that kind of thing. So
okay, that's simple. But you just do your standard dictation as you would normally, just after the appointment. It's just like seeing them in the office, no different. Okay.
Exactly. Yeah.
All right.
Okay. If there's no more questions,
I have one.
Go ahead. Yeah.
What does the patient need? Do they have to download the app, or do they just call in?
So there's a few options. If they click on your link, they can just open it up in any web browser. They don't need to download anything. If they want to use, they would rather conference you on the phone, they can download an app which is free. And then they just basically, they paste your link in there and then they can get into your room that way.
We just paste them a link. We just give them a link and then they get on.
Exactly. Yeah.
And it can be done on any device?
Android or Apple, yeah. As far as I know, yeah.
Common devices. Yeah.
Exactly, yeah. I don't think there's a BlackBerry app. But
I'm sure there isn't, but if you have an iPhone or a Samsung, they can get you.
Yeah.
Okay.
This is Angela Bearwald from Family Medicine. Just wanted to let you know I, as well have not received an email to register. So I'll have to set my profile up as well. So just wondered if somebody could be in touch with me to help with that.
Sure. A request in as of yet to the EMR email?
I believe our office administrator did, Colleen Brockbank.
Okay. I'll check if you have made it to our list or where your account is at.
Perfect. Thanks very much.
And I'll let you know. Yeah.
I have another question. For patients, do we need to send them information about which browser to use for which device, or does that matter only to the clinicians?
Yeah, definitely. I think you'll probably get questions from the patient as well. There's an email template that you can use when you're informing the patient of their next appointment will occur via video. Here's how you log on. Here's some options, troubleshooting. There's a few documents if your patient is having, a lot of trouble figuring out how to log on. There's a few other help documents that they can use. But by and large, I think it's very simple, just to, depending on obviously their tech savviness, but to be able to click on a link and open a page it's as easy as that. So, and if they have audio or video issues, that's usually the biggest problem, but hopefully they don't need that much support, but there's a few documents out there that they can have support. And then also you can give them the 1-800 number for the support desk for Telemerge, and they can get some help that way as well. Okay, so if there's no other questions, I think we'll close it off now, and definitely reach out to the EMR team if you want to learn a little bit more or book on a one-on-one training. And Dr. Fraser, Dr. Muin, and Dr. Baywald will be following up with you tomorrow morning with your request. And thank you.
Perfect. Thanks. I'll be waiting for them. Thank you.
Good night. Have a good night, everyone.